The Kaiser Family Foundation presents Health08.org, election news, analysis, and events.
Governor Huckabee, thank you for joining me today.
Thank you, Jackie. It's my pleasure.
On the campaign trail, you will often say that there is too much emphasis on a healthcare system, not enough on a health system. Is that your starting point in discussions about how you would like to see the system work at its optimum level in the United States?
It is, Jackie, because what I try to remind people is that the real crisis in America is not health care, it's health. 80% of our costs in health care in this country are being spent on chronic disease, and it's mostly driven by three behaviors of overeating, under-exercising, and smoking. It's not that we don't have some serious systemic problems with health care, particularly in terms of access, affordability, portability. Nobody is denying that. But the true crisis is the fact that about 15% of America's population access 85% of the resources because of an extraordinary crisis that we have with the poor health of America's people. What that results in is that we really don't have a health care system. We have a sick care system. And the entire thing is upside down because it's focused on intervention at the crisis level rather than prevention before it ever gets to that point.
If America became healthier, do you think that would solve some of the serious systemic problems, or would those systemic problems remain? And if so, what are they? How would you approach them?
It would certainly solve some. It would, for one thing, revolutionize our economy in that we currently spend 17% of our gross domestic product on health care. And that is so disproportionate to anyone else in the world. 10.5% is the next country of spending, Switzerland. Then it starts going down substantially after that. So if we were at 11%, still more than anybody else, the savings annually is $700 billion a year. So the first way it would transform our nation would be economically. But the other thing that would happen is that there's frankly enough money in the total system so that everybody could have coverage. You know, you hear sometimes that the real crisis is 46 million Americans don't have health care coverage. Of those 46 million, a third of them don't have it because they have enough money, they just don't need to buy insurance, they just pay for it. A third don't have it because they could afford it, they just choose not to because they're either young, they're healthy, or they just don't want to engage in the process. A third don't have it because they really can't afford it, they don't have access to it, they're the most vulnerable and the ones that we really need to be worried about. But here's the reality. It's not that there is not enough resources to make that happen. It's that the misallocation of resources and the fact that we're spending so much of it propping up people who are desperately ill because of lifestyle, again, the chronic disease issue, and it's just creating for us a genuine crisis of health.
But what are your solutions then for the number of people who are uninsured because they truly cannot afford it?
Let me talk to not some theoretical, but what I actually did as a governor in Arkansas. Prior to an S-CHIP program, we really pioneered the concept of preventive and primary care for children with a program called Our Kids First that I launched in 1997. And what it did, it put a safety net of preventive and primary care for children of working parents who made too much money for Medicaid but not enough to really access the system. We think we showed in that system, by insuring over the course of the last decade over 200,000 kids, that it's not a cost issue, it's a savings issue when you focus on preventive primary care. It keeps kids out of the emergency room, it gives them access to a primary care physician, it gives them regular checkups. The key to it is that moms and dads have a very small, very limited, but at least an affordable copay and deductible that gives them some skin in the game, which is critical to any health care reform situation. If you give everybody whatever they want, and the old thing is for free, I think it was P.J. O'Rourke who said the most expensive programs that we ever have are the ones that are free. And truly, it's a matter of realizing that we can do more than we're doing. We did the same thing for small businesses, Jackie, in my last year as governor, creating what we call the Our Health Net. And it was for small business and employers who wanted to provide some safety coverage for employees. Having done these things, these are not things that are going to start next year or the year after that. These are in place, and they've been effective. And I would suggest that we ought to be doing things to give people that peace of mind. And it's a partnership between government, the private sector, and the individual. It's not government doing it all. It's not forcing it all on the individual. And it's not saying to the employer, we're going to mandate it for you, and somehow you're supposed to eat it all.
It sounds then that you very much believe government has a significant role to play and that it needs to be the driver of some of these initiatives.
Well, government does have a role to play. We don't want to see is government taking the system over, which means that consumers would not make choices about their doctors, hospitals, procedures. It also would sort of disenfranchise the individual consumer from understanding what his options are. That's not a good thing. What is a good thing is when government serves to stimulate the system, creating innovations and ideas. I think these best happen at the state level. Turn states loose to come up with the best solutions, because real reform rarely emanates from Washington. It typically emanates from state capitals, because governors and states have to balance budgets. They can't print or borrow money. They come up with ways to reform welfare, education, transportation, and I'm convinced that's where the future of health care reform from a government perspective is. What I think has to happen is that we begin to systematically change the entire health care industry from top to bottom, from the way we train doctors, training them more toward prevention focus than intervention focus. We need to work with insurance companies so that they start covering the things that help people live a healthier life. Let me give an example. Currently, insurance companies will pay if you have a quadruple bypass. It may cost a couple of $100,000 for the surgery, the rehab, the hospitalization, and all the associated issues that go with it. If that same insured person had gone to a nutritionist and maybe gone to a personal trainer and taken the steps to have gotten control of one's health, never needing the bypass, that person would have been told, that's wonderful, now you pay every penny of that on your own. So the point is, should we spend a few $100s to prevent people from being sick, or should we wait until they have a catastrophic illness and then spend several $100,000 in order to try to make them well, knowing that they'll never be as good as they would have been had they avoided the quadruple bypass in the first place?